So E3, Dorothy, so she's a fracture of the leg. We've made some more changes to her medication, and basically we will see how she does over the next, say, 24, 48 hours.
I'm here because I broke 2 bones in my ankle. Been here for nearly 3 weeks.
91-year-old Dorothy, or Dolly as she's known, is one of the hospital's oldest patients.
I feel good in myself. I do. I feel as though I could get up and walk, you know, the way I am. But I can't because I've got a broken ankle.
Can you take a few deep breaths for me, please? Can you take a few deep breaths for me? So through your nose and out through your mouth.
Are you happy to be here?
Yeah, I am really, because I'm getting the treatment I need. I mean, I don't know if you want to know, but for instance, I passed out this morning and they was all there to rally round, to, you know, bring me round and see to me, whereas if I'd have been at home on my own, I don't know what would have happened. I really don't.
It might not be necessarily dangerous to someone that's like me or you. However, to someone at her age, her fantastic age, it's quite dangerous for her to be on her own.
Dolly is waiting to be moved to a community hospital where she will convalesce until she's well enough to go home.
Dolly, are you in any pain right now?
No, love, I feel fine. Jess, I feel, honestly, really.
Sometimes patients stay here longer than they need to, but we haven't got necessarily this middle ground right now in between a hospital and a home. So that bed's being used.
They're so short of beds that if you're just a patient and they're just giving you tablets, you're wasting a bed. But then I have to have somewhere to go where I'm going to be safe.
What does that feel like?
It feels awful. Not supposed to be here, which I'm not, in a way, because they want my bed. So what have I got to do? I feel guilty because I've got nowhere else to go.
91-year-old Dolly is waiting to find out if she can be discharged today.
Here we go. Mrs. Jackson, nice to see you again. When we saw you earlier on this morning, you were looking pretty unwell. Now, as you know, we'd hoped to get you home later, well, not home, but to Willesden Community Hospital this morning for a bit of rehabilitation and some convalescence. But I think, given that you had your collapse this morning, we should probably keep an eye on you here.
Yeah,
Okay.
I think I'd be better off.
So I think what we're going to do is hang on to you for at least another 24 hours, and then we'll send the referral again to the rehab hospital. But unfortunately, because they've given the bed up to another patient this morning, we might end up having to keep you in here for a few more days while we wait for it to come up again.
Okay.
Okay?
Okay.
Very nice to see you. Bye-bye.
The problems that we face can only be solved really by social services creating spaces for people in accommodation, be that for homeless, drug users, or for people waiting rehousing, or for nursing homes. There's a big disconnect between the NHS and social services, and the NHS gets blamed quite a lot for problems in the community, which are really sort of slightly outside of our remit and outside of our control.
One of those things. Sometimes it happens. But otherwise, you look good, isn't it? Yeah. Okay, then. All right, I'll see you later, then. It's good at least you are with us, no problem. We take it from there.
Thank you.
You liked the one I got yesterday of William and Harry, didn't you?
Oh, yeah.
That one?
Yeah. And that good.
It's the one you want blown up,
think
isn't it?
you can just take their photo just like that.
Dolly's granddaughter Nicola has come to visit, with Peter, Dolly's husband of 32 years.
Where did you guys meet?
Oh, we met in a pub. She's definitely a fighter. I mean, she's had a lot of accidents, a lot of falls.
No.
It's not the first time she broke her ankle. She went to Spain once with her friends. What did she do? Went roller skating and broke her ankle. That's Dolly. She's got quite nice legs when they're not like that.
Always had good legs. Nice legs, shame about the face.
No good her coming home because she won't cope at home. I know she won't. They did have a place for her, care home, but whether she's lost that place for good, we don't know.
You had your boot on today?
No, I ain't been out of bed because since I've had that turn, I had to stay in bed. But to have a bedpan and all, no commode. In case I fell off the commode again.
Hello, good morning. My name is Magdalene. I'm a sister in St. Mary's Hospital. We have a lady who is supposed to come to you yesterday. Her name is Dorothy Jackson. There was a delay and you asked us to call today to confirm what time she can come. Everything is ready, yep. Yes.
You look nice today.
Oh, thank you. I did try. Thank you very much. I'll be back in a little bit.
Okay, Jess, thanks, love.
I want to see her get home and I want to see her in her own clothes and doing her own things and enjoying her life and not stuck in hospital. It's not nice to stay in hospital for this long.
All right then, take care. Thanks, bye. Definitely she's on their list. So if everything is fine with the doctor and she's stable here, then they'll get a bed for her. So we are sure she will go today. I've come with good news for you. You need to go to Willesden today.
Yeah? They got space for me?
Yes, we've spoken to them.
All right.
They have a bed for you.
Well, that's it then, isn't it? I'm off your books. Yeah, that's good news. So I'm still waiting.
She got everything ready and she's been told she's going. Everybody knows she's going. And now we're waiting for transport.
So the problem with getting a place in the care home has been solved. But now I've got to get there. So we've got another problem on our hands. You don't know whether you're coming or going. I might have to stay here all night again. Like this. There's Dolly stuck in her bed with her big boot on. It's a farce, really. It could be made into a comedy.
If you work in an acute hospital, you will have cancellations from the high dependency, from the intensive care, from the theatre availability beds. It's inevitable, isn't it? Is it more frequent? I don't know. It feels real every time. It always feels like it's the worst thing in the world, and it always feels like it's happening to you. But we get a lot of work done here, and we're very proud of the work we get done here. You've seen the very worst of it.
Young Dorothy.
That's me, love.
I'm Dave, this is Graham. We've come to take you out.
I don't know if you'll have room for me boot, will you? Thank you, love. Thanks to you.
As one of London's 4 major trauma centres, St Mary's is facing increasing demand on its emergency department.
Oh yeah, trauma team to A&E resus, please. Thank you.
Sorry, guys, they're going to come in.
The latest patient to arrive in A&E is 21-year-old carpenter Harry, who has fallen 2 floors at work.
Fallen from height? From 4 metres. From 4 metres. You're not worried about he's got a head injury.
Well done. It's just some oxygen. It's just
Stop that, please! Harry!
Harry.
Fuck that shit! Fuck off!
All right, Harry, you're okay, you're okay, you're okay.
Fucking hell, stop it!
All right, sweetheart, it's okay.
Please, Harry!
All right, Harry, you're doing really, really well. I know it's horrible.
Harry's agitated behaviour suggests he may have a brain injury.
OK, tube, intubate, yeah.
Lovely.
He is anaesthetised and his breathing is supported so the doctors can ascertain the extent of his injury.
It looks almost certain that he'll need a bed on the intensive care unit, which is not the easiest thing, seeing as we know already that the intensive care unit is completely full to the rafters. That might be them. And yes, it is. Hiya. Have you got anything you can kick out there? Yeah, I know. I think we should probably prepare for it. Yeah, absolutely. Okay. Talk to you later. Bye.
Is it always like this?
We've always had times when it's been like this. The emergency service has peaks and troughs in demand like that, and the peaks and troughs are going up and up and up. There are times when I start thinking, whoa, okay, if another thing happened now, the system would break, and we'd be in really, really serious trouble.
Scans will help to determine how serious Harry's injury is and whether he needs one of the sought-after intensive care beds.
Debbie. OK, Debbie, we'll expect to see you soon. Thank you. Bye-bye. Mum's on the way.
Harry's girlfriend Paige and mum Debbie arrive at A&E.
I said to the nurse, he's not going to die, is he? And she said, I don't know, we can't tell at the moment. And I thought I was going to die right there on the spot. He's 21 years of age, he's got a little baby. It's just so frightening. And I know he's in the best place, but it is really frightening, really frightening.
The scans show Harry's brain injury is not as serious as first thought. But it's still unclear how much medical support he needs and which ward he will be admitted to.
We're going to wake him up, and fingers crossed, we'll be okay.
Harry, can you open your eyes, Harry? Open your eyes wide. We'll take the tube out. Just keep taking some nice deep breaths. We'll take the tube out.
If the breathing tube stays in and he stays on the ventilator, he is classed as a level 3 patient, which means that he needs the maximum support that we can give him, and that is an intensive care unit. Whereas if he does the breathing for himself and we're not having to support his blood pressure terribly much and he's looking moderately stable, he is a level 2 patient and he goes to a high dependency unit.
Harry, can you open your eyes wide? Open your eyes wide. We'll take that tube out.
I think there's more space in the high dependency unit than there is on the intensive care unit at the moment. So I'm secretly hoping that we'll be able to wake him up and take the tube out.
Okay. Nice deep breath in and out. Shall we just bring him up a bit? You're just waking up, Harry. You are in the hospital. You are in St. Mary's Hospital. You had a fall. Just keep taking nice big breaths.
Good. Excellent. Lunch.
Okay, do you want to sit up for me? Just sit, if you can sit on the side of the bed and face me.
Harry, who came into hospital yesterday after a fall, has spent the night under observation on a high dependency ward.
Very good.
He's not very well today, he's crying. Said his head was really hurting today. And we're just waiting. I'm waiting to see the doctor now to see what's happening.
Okay, so eyes wide open. Very good. That painful?
That really hurt. He wants to go home, that's what he keeps saying. He wants to go home. His Paige is 21 tomorrow. Paige is Harry's girlfriend, so he was cooking her a nice meal. And she told him all what she wanted, chicken. And now this has happened.
So if you turn your head to the left, And keep it like that. And I'm going to count to 3. I'm going to tip you quickly on this shoulder.
We're now going to say that her birthday's next month, and hopefully Harry will be all better. We can all go out and celebrate.
Okay, so we'll do it together. On 3. 1, 2, 3, go. Excellent. Eyes open for me. Superficially, it looks like he's got a serious problem. And yes, he's had a head injury, and this is not a banal situation. It needs to be taken seriously. However, the clinical assessment is overall quite reassuring. And he should make a good recovery from this with the right treatment.
Harry is expected to stay in hospital for the next few days.
I've only just recovered from breaking my ankle. I've only just gone back to work.
You're joking?
Yeah, I was off work for 6 weeks. I broke my ankle. I've only been back about 3. Now I'm going to be off another 8. I fell down 2 levels. Lucky I'm not dead, really.
Fucking pulled that!
When he started swearing a bit, we knew he was still there. That's it.